are you today?
Hi, I'm doing good. How are you?
Good. I'm a nurse practitioner, and I just wanted to complete your history and physical, okay?
Okay.
So how old are you?
I'm 27.
27, great. Alrighty. And what do you identify as far as your race?
Middle Eastern.
Okay. So you consider as
Like, here I have to put white.
White?
Caucasian,
Okay.
yeah.
Okay, we're just to look for your assessment. We're looking for anything abnormal, just see what you identify as. Alrighty, so what brings you in today?
I'm just here for a physical. Just a regular
Physical?
yeah.
Okay, great. Awesome. Just to jump in, anything bothering you at the time, like any problems?
No, I don't have any complaints at all.
Okay. Alrighty, and if you're just seeing me jotting down some notes, I'm just writing them down for my note later and just to refresh my memory. So, do you have any past medical history?
Surgeries or stuff? Like
Surgeries and anything that you were diagnosed with?
Yeah, so I previously had a hiatal hernia that I had
Okay.
to get surgically repaired. That's all I have.
Okay. And when was this surgery?
4 years ago.
4 years ago, so 2018.
Mm-hmm.
Awesome. Do you have any complications from that surgery?
No. Nothing.
Everything went well? Great. Have you been hospitalized besides that?
No, never.
Excuse me. Excuse me. Any broken bones previously or any injuries?
No.
Accidents, anything like that? Head injuries, loss of consciousness ever?
No, never.
No?
No, I've never broken a
Okay.
bone. I've never hit my head that I can recall.
Awesome. Are you currently taking any medications?
No, I don't take any medications. I don't like taking pills.
So nothing, not even for pain, anything like that? And menstrual cramps, headaches?
I don't get cramps as much, but like I would get occasional headaches, but if I just go to sleep and I wake up without a headache.
Okay, good. Do you take any vitamins, or I would say any vitamins, any herbal medications, supplements?
No.
Herbal teas?
No, I just drink regular tea.
Regular tea, okay.
No, I don't take any vitamins. I don't like taking pills. It bothers me.
No pills, okay. Great. As far as allergies, do you have any allergies?
No.
So no medication, environmental?
Not that I know of, no.
Latex, food?
No.
Okay. Alrighty. And as far as your immunizations, are we up to date with everything, or do we need to give you anything today in the office?
No, I'm
flu
up to date
vaccine. I'm sorry, your flu and your COVID.
I'm up to date on everything.
Everything, okay. Even your childhood vaccinations.
Yeah.
Okay. Do you have the TB vaccine as well? Because you mentioned you were overseas. Have you gotten that shot before?
Yes.
Okay.
Yeah.
Just wanted to ask about that. And as far as your health maintenance, I know you're in the office today, which is great. So you're here for a physical. Do you go to like gynecologist, your eye doctor, your dental visits, all that's up to date?
Yeah, everything's up to date. I just saw everybody 6 months ago. Like I like to get everything out of the way at once. So yeah, I saw everybody. I don't have any dental issues or like eye problems or like.
Okay. And with your gynecology appointment, everything was pretty normal.
Mm-hmm.
Gynecologist didn't mention anything.
Nope, nothing at all.
Okay.
She said everything looked good. Everything is fine. If I have any complaints, to let her know. But I don't have anything.
Okay, great. And I know you said you don't take any medications and no birth control, right?
No.
Okay, so you don't really get bad menstrual periods or any?
No, not really.
Okay. Not really meaning
like I don't feel like I'll feel like a little like cramping, but like it's tolerable. You know, I don't feel like I ever need to take medication for it. Like, I never felt like it's so severe that I would need to take any medications.
Okay, that's good. You're one of the lucky ones then.
Thank God.
Great. So what I want to ask you now is just from your history, like from your parents' side and their parents. So we're just going to start with your dad. Is your dad present at the time?
Yeah.
Okay. And how old is he?
He's in his 50s.
Okay, so early 50s or
early 50s?
Okay. Does he have any medical problems that you know of?
No, actually just high cholesterol is from what I know. And I know he takes medication for it. So.
Okay, high cholesterol. So he's managing that. So his, like your grandparents from your paternal side, Are they alive or?
No, they're both deceased.
Okay, I'm sorry about that.
That's okay.
How long ago was this?
Like maybe 5-7 years ago. They both died around the same time. They were really old.
Okay.
So they just passed away in their sleep. Really, just
both
of
okay.
them.
And
Yeah, one passed away 6 months before the other one did.
Oh wow. Okay. Yeah. And you said this was 6 to 7 years ago.
Yeah,
5. Okay.
Yeah, 5. I can't
Okay.
recall.
No, it's okay. It's okay. We're just trying to get like just an estimate. No problem. And both were in their 80s. And you said both died in their sleep?
Yeah.
Did you have a hard time coping with that just because it was like such close like period of time with both of your grandparents passing away?
I wasn't very close with them, so I was feeling the grief, like light grief, but like also my family's so I still live with my family, so like my family was around if I was feeling any kind of upsetness or we were like, they were a good support system for any kind of grievedness or any kind of sadness that I would have felt.
So just like talking to your family and being around them was really what helped you. Alrighty, well, that's good that you do have a great support system. As far as your mother, does she have any past medical histories?
No, my mom's very healthy.
Okay, how old is she?
Late 40s.
Late 40s? Okay. Late 40s. And you said no medications, no past medical history. Great. Has she gone through menopause yet?
I don't think so. I think she still gets her period.
Okay.
We stay together.
Okay. So still gets period. And then her parents, are they alive?
No, her parents are also both dead.
Okay. I'm sorry about that as well.
That's okay.
Do you recall like what age or what was the cause, or if they have any past medical history, either one of your grandparents from mother's side?
Honestly, my mom's dad died when she was 4 years old, so I don't know anything about him. I just know he had a heart attack.
When you were
and
4?
Died. My mom.
Oh, when your mom
my
was
mom
4.
was
Okay.
4 years old. He had a heart attack and he passed away then. And my grandma, all I know is that she had diabetes. But she died. An accident happened and she passed away.
Okay.
Yeah, so she didn't die because of the diabetes.
Okay. And was that one hard on you?
It was hard because I was really close with her. But again, I was there with my family, so like my family was a very good support system for me.
Okay. So you didn't go through any depression or anything? Well,
I just the sadness, just the base, just the grievedness. Yeah.
Okay. And she had diabetes, you mentioned?
Yeah.
Okay, but cause of death was, okay. Alrighty, and she was how old? Do you recall?
God, I don't know. She was pretty old. She was, I want to say, late 80s.
Okay. Alrighty, so, moving on from that, are you in school? Are you working right now?
I'm in school.
Okay, what are you studying?
Education.
Education, okay.
Yeah.
Alrighty. And are you working?
No.
Okay. So you're just studying at home. Are you taking summer classes right now?
Yes.
Oh, okay,
yes.
okay.
That's all the way around.
Okay. So how is that going? Are you feeling stressed from that, or how are you okay with doing your schoolwork? Are you able to focus?
Yeah, I'm pretty good with, my school. It's just stressful around exam time, as it is for everybody, I assume. But yeah, I think it's going good. I'm motivated to finish it and get it done and over with, but.
Okay, great. How much longer do you have?
About a year.
1 year, okay. So you're almost there. Perfect. So do you hang out with friends? I know you said your family, you guys are close, you live with family right now. Do you have friends, like this good social group that you kind of go out with?
Yeah, I do. I actually have friends from my childhood, so we're pretty close. They come and hang out by my at home sometimes because they're also involved with my family. Sometimes we do things outdoors. It's always a different kind of social.
Outdoor. Do you guys ever drink? Do you drink?
No, I do not drink. I'm Muslim, so I'm not allowed to drink.
Okay, you're great. I was gonna ask about your religious beliefs, preferences too. So you are Muslim, so you do not drink. As far as smoking, do you smoke cigarettes, hookah, any tobacco use?
No.
Any marijuana?
Okay. I don't do any of that.
So no drugs. Wow. Okay, that's good. You're pretty healthy then. It's good. You're avoiding all that stuff. And besides school, do you feel like you have any other stress factors in your life currently?
No, not really.
That's good. All right. And then if you ever do feel stressed, you do go to your family or friends.
Yeah,
you feel like
almost always, like when something like.
So you never feel alone by yourself dealing with anything that's stressing you out.
No.
Okay, good. So no smoking, no drinking, no drug use. You feel safe where you're living?
Yeah.
Great. We ask everyone these questions.
It's okay, I understand.
And you're safe, no physical, no emotional abuse, none of that. Great. Are you sexually active? Have you been before?
No, never. Like I said, I'm Muslim, so like we can't have sex before marriage.
Okay.
So I've never had sex, and I'm not currently sexually active.
Okay. And just to ask, I don't want to make assumptions. Never had basically an STI, like an infection or anything related to sexual. Okay.
No, I just saw my gynecologist 6 months ago, and everything came back good and clear.
Okay. So your Pap smear was at that time too, 6 months ago.
Yeah.
And a pelvic exam. Okay.
Yeah. She
Great.
said everything looked good.
Awesome. So, do you exercise? How is your diet?
I don't exercise, but like I do try to watch what I eat. So like I try to get in my protein. I try to eat my salads, and like I try to drink a lot of water.
Balanced diet. Okay.
Yeah. But I do not exercise. No.
You do not exercise. Okay, that's fine. And it is although important to get some exercise in here and there if you're able to, especially with school. It's also a great coping mechanism too if you're ever feeling stressed besides your family and friends, okay? Have you had any recent weight gain or weight loss?
No, just like fluctuations between 1 pound or 2 pounds, 1 pound or 2 pounds.
Okay, good.
Yeah, but I've been like maintaining the same weight.
Good. And any recent travels you've had?
No, I haven't traveled since I started school because I'm doing summer classes as well, so I don't have time.
I know exactly how that feels. I completely understand. Okay, so thank you for answering those questions. So what I'm going to do now is before we actually do the physical assessment that I'm actually assessing you, I want to kind of go over systems with you so if you can tell me from your point and your side if there's anything that's bothering you.
Okay.
So general, we ask you, do you feel like you're pretty healthy?
Yes, I do.
Okay, good. I like to hear that. As far as your hair, any hair loss, any abnormal hair growth anywhere that you've noticed?
No, just my head right here. I hate my armpit hair, but like, yeah, no, I don't have
nothing facial, like around chin, nothing like that. Okay, good. Nails, okay?
Yeah,
hands and feet, nothing breaking, thinning, good.
No.
So and
they're pretty strong.
Okay, good. And then skin-wise,
skin is good.
No dryness, no lesions or anything you've noticed, abnormal moles?
Only if I ever get sunburnt, because I like to be out in the sun, but no, I don't, there's nothing that's concerning about my skin.
Okay. And I do see some scars on your abs. Is that related to your surgery?
Yeah, that's because repairing my hiatal hernia, they did like a laparoscopic one.
Okay.
So I have 5 scars, so like 4 across here and 1 over here.
5 scars, okay. Do you wear sunscreen when you're out in the sun?
Oh yeah.
Good. That's very important. Head. Any headaches, blurry vision, any dizziness, vertigo?
No, I do get headaches like occasionally when I'm like looking at my computer for a very long time, but I just go to sleep and it's just completely gone. But no blurry vision, no vertigo, nothing.
Okay. Do you take any medications for that?
No, I just like I said, I don't like taking meds, so I just go to sleep. Honestly, the dark helps. I just go to sleep, wake up, perfectly no human.
They're occasional. Alrighty. As far as your eyes, do you wear glasses?
No. No
glasses. Okay. You feel like you're seeing fine driving at night, during the day. Any itchiness from your eyes?
No.
Discharge? Anything that you've noticed?
No.
And no pain, pressure? Good.
No.
As far as your ears, anything that I need to know about?
Nope, nothing. I don't have any complaints with my ear.
Okay. What about your nose?
Nope.
Any drainage, tenderness?
No, nothing.
Any snoring or hard time breathing at nighttime?
No, I actually don't snore. My family told me I'm the only one in the family that doesn't snore.
Good.
But no, I don't have any complaints.
Okay. And then as far as you said you see your dentist regularly, have you ever had any problems with your gums, with your teeth?
When I was younger, I used to get cavities, but I haven't had cavities in like over 10 years maybe.
Okay, good.
And no, my last appointment with my dentist, he said how healthy my gums looked, and like the length was good, like for my teeth, so he was very proud of that.
Did you have your wisdom teeth removed?
Yes, I did. I guess that's a past medical history. I apologize.
No, it's okay. And tonsils are still there?
Still here.
Okay. Have you noticed any enlargement, anything here in your neck, any neck pain, stiffness?
Nope.
Discoloration?
Nope.
I mean, I'm not noticing anything either, but just to ask, okay, we're just going over system. Breast examinations, do you perform those?
Yes, I do.
Okay.
Yeah, I was taught by my doctor. She said to just like check my breasts after my periods, like 5 days after my period, just to like feel around, see if there's any like bumps or lumps and
pads
stuff.
Of your fingers, and you're bending over, making sure you're actually going in and looking at your nipples, everything. Okay, and once a month you're doing that. That's awesome. That's very, very good. Important. As far as your chest, have you ever had any palpitations, chest pain?
No.
No. Okay. Do you drink coffee?
I do very, very occasionally though. Only when I feel like I'm very tired and drained. Then I'll have a glass of coffee, but
it doesn't make your heart rate go up, or you don't feel like jittery?
I don't feel jittery, no.
Coldness. Okay.
No.
Breathing fine? Nothing triggers it outside, environmental, that you're like coughing, any sputum?
No.
Okay. No night sweats?
No.
You've been sleeping okay?
Oh yeah. I try to get in at least 8 hours of sleep a day.
Okay.
If possible.
You're not like constantly waking up or anything?
No, I sleep throughout the night.
Okay, good. And then I know, like, as far as your stomach, like that area, your abdomen, you told me that you just had that hiatal hernia surgery. And any, you've been having regular bowel movements?
Yeah.
No issues? Okay. Bowel movements are every day? Or?
Yes, daily.
Okay. And they're normal, formed, everything?
Yeah.
Okay. How about your urinary, like your urination, your peeing? No pain?
Fine. No pain. Doesn't hurt like when I pee or anything.
No discharge?
No.
So no pain, no discharge, no blood that you've noticed, discoloration?
No, nothing at all.
Okay. And no excessive urination?
No.
Okay. Good. And then you said your periods, you don't really get a lot of cramps. You've had your appointments. That's great that you're actually keeping up with all that. Have you had your HPV vaccines actually?
I have, yeah.
Good. That's actually, I mean, because you're 27 now, so it's like before 26, you've had that done, hopefully. So HPV vaccine done too. And then you get your periods once a month?
No, yes.
How many days typically?
I actually put it in my Flow app, and according to my Flow app, it's 28 days exactly.
Good. Been bleeding? Been okay, normal?
Yeah, it's normal bleeding. Periods like 5 to 6 days.
Okay.
Yeah, just.
And you're not
red.
Not excessively changing your pads.
No.
Throughout the day.
No.
First,
like maybe like 3 times a day.
Okay.
Like, which I would say like whenever I go and pee, I just like to change it.
Yeah. Just for hygiene too, and you don't want to get an infection. Any numbness or tingling in your hands or feet? Any like loss of like, say like you're holding something and you feel like all of a sudden like you feel like you can't hold it, like your strength is gone, or your hand goes numb, anything like that?
No.
Okay. No joint pain, stiffness in the morning?
No.
Your period, good. Any blood disorder, like are you bleeding excessively if you get a cut or anything like that?
No, I don't bleed. I don't bleed excessively.
And then did you have blood work done?
When I went to my doctor 6 months ago, yeah.
Good. And as far as your hormones at like thyroid, did they mention anything that was like abnormal?
No, they did full blood work. I know they did like my red blood cells and stuff like that, and like they did my ions and stuff in my body. They said everything is fine. They did my thyroid. They said that's good. My vitamin D was good. They said everything came back fine.
Okay. And the psych history, no thoughts of like, no depression, right?
No.
Thoughts of harming yourself, suicide.
Mm-mm.
Okay. And you feel like if you ever do have those symptoms, you would talk to someone about it.
Yeah.
If you ever feel like you're depressed or anything. Okay, good.
Absolutely.
All right, well, that completes that portion of the test. Okay, thank you for answering those questions. We're going to jump right into your physical examination now.
Okay.
So I'm just kind of like basically whatever we went through, I'm just kind of going to go ahead and actually physically assess you for the parts of your body, okay?
Okay.
If that's okay. Alrighty. I'm just going to go here and inspect your head first.
Okay.
Lumps or anything. I'm just going to touch your ears. Sorry if my hands are cold, actually.
That's okay.
Okay. And no tenderness here.
Nope.
Okay. And then your cervical spine.
Nope.
Okay. Great. So what I'm going to do now is we're actually going to check for your visual acuity.
Okay.
We're going to check for your vision, basically. I'm going to have you hold this.
Okay.
Extend your arm out. Great. So what I'm going to have you do is cover one eye at a time, and then you're going to uncover both eyes, but you're going to read the smallest line that you could for me.
Okay. LTFPH.
Okay.
Like this?
Yes.
LTFPH.
Good.
The same one, LTFPH.
Good. So you have a 20/20 vision. Great. Thank you for that. So I'm just going to go ahead and inspect your eyes now. I'm going to use some hand sanitizer here. Sorry, because I'm going to get close to your eyes. So just taking a look. I see that your sclera is white. Looking for that. And then I'm just going to pull down on your bottom lids. Look up for me. Okay. And then I'm just going to, touch here.
It's okay.
For any drooping or anything. And then I'm just going to go ahead and inspect here your basically your tear ducts and your glands. Okay, eyebrows are distributed. I'm going to test for your sinuses too, okay? Any pain or tenderness?
No.
Good. All right. So moving on with the eye examination, I'm going to hold this pen light here. We're going to test basically for the eye movements. So what I'm going to have you do is just look straight at me.
Okay.
Only with your eyes follow where the pen light goes, okay?
Okay.
Good. I'm just going to get close there. Good. Okay. So next thing I'm going to do is look straight ahead for me. I'm going to shine a light in your eyes, and we're going to check for constriction of those pupils. Okay. Pupils are reactive to light, and they constrict. Good. So I'm going to take this device here, shine a light in your eye, and I am going to get a little bit close to your eye. We're just going to check for those internal structures.
Okay.
Good. I'm going to come on this side. Perfect. Okay, the next thing I'm going to do is I'm going to just go ahead and inspect your nose. Okay. Now we're going to take a look inside of the nose. Light. Okay. And then we're going to do a various test for your hearing, okay?
Okay.
So I did touch the ears. I'm not noticing anything, no pain or tenderness, right? Okay, earlobes. I'm going to go ahead and take a look inside.
Okay. Is my hair back enough? Here, let me fix that for you.
Thank you.
Okay.
Good. Check here. So now I'm going to take this here, I'm going to activate it, put it on the crown of your head. Let me know which ear you hear it, and if you hear it in both or just one, okay?
Okay.
Oh.
I hear it in both.
Okay. Now just tell me when you feel the vibration stops, okay, with this one?
Okay. Stopped. 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 Stopped.
Okay, good. So now I'm going to go ahead and inspect the mouth. Just looking around it, just going to touch here. Okay, if you can go ahead and pull that bottom lip down for me. Good, just want to, and then you can pull the top one, just looking for any lesions or anything. And I'm just going to shine a light in your mouth, if you can say ah. Okay, the uvula does go up. That's normal, and I'm not seeing that you have any missing teeth except your wisdom teeth that I see top and bottom. Okay, good. So now I'm going to just put this tongue depressor in your mouth, and I'm just checking for your gag reflex, okay?
Okay.
Okay, sorry about that.
It's okay.
And then if you can just stick your tongue out for me, up, down, side to side, and then push up against this for resistance with your tongue. Good. So now we're checking for the facial muscles and nerves. So what I'm going to have you do is squeeze your eyes for me, raise your eyebrows, if you could smile, if you could frown, if you could puff your cheeks. Okay, so I am going to put a sharp and a dull object on your face. With your eyes closed, if you could please tell me what you feel, okay?
Okay. Sharp.
Okay.
Soft. Dull.
Okay.
Sharp. Sharp. Dull.
Okay, good. So next thing I want you to do is kind of bite down. Okay, I'm going to check for these temporal pulses here. Good. I'm going to take a listen to them as well. Good. So while we're doing that, can you push down on my hand while you're biting? Good. I'm just checking here again. Good, good. So while we're still doing that, you can relax your jaw. Go ahead and push against resistance on my hand. Any pain or tenderness?
No.
Okay, shrug your shoulders up. Good. All right, I'm going to check for those carotid arteries too right here, one at a time, and then I'm going to listen to those too, okay, while we're doing this.
Okay.
Okay. Go ahead and take a listen to those. Not hearing any abnormalities, that's good. Okay, so next thing I'm just inspecting the neck. I'm not noticing any discoloration. Gonna feel for the trachea here, okay? If you could swallow for me. Good, good, good. Okay, now I'm just checking for your thyroid gland. I'm gonna come on the back here, just relax normal, and then go ahead and swallow for me. Good. Awesome. All right, so, I'm sorry, excuse me. So now I'm going to check for your lymph nodes, okay? We're just looking if they're like tender, if they're like swollen, okay? That can tell us if you have an infection or not, but I am going to name them, okay?
Yeah.
So preauricular, postauricular, we have occipital, we have your tonsillar, submandible, submental, and then I have your superficial cervical, I have posterior cervical, deep cervical, and then your supraclavicular, or deep clavicular, I'm sorry. Okay, good. So the next thing we're gonna do is, I'm gonna go ahead and do your lungs. So what I would have you do is, I'm actually gonna have you take a seat on this chair here, if that's okay with you. Yes. I'm gonna put it here, and we're gonna inspect the spine, okay? Actually, while you're standing up, since I do want to inspect your spine before I listen to your lung sounds, if you could kind of just bend over for me.
Like bend over?
Yes. I just want to take a look, and then come right back up. Okay, good. So what I'm going to have you do is actually face this wall for me, please.
Okay.
Thank you.
Sit down?
Yes, you can go ahead and sit down. So before we do your lungs, I do want to go ahead and just test here. Are you able to, while I'm doing this, put your head down for me, chin to chest, good, and then up. If you could rotate from side to side as well. Any pain or tenderness?
No.
Okay, just checking for the range of motion there. And no tenderness here, right?
No, nothing.
Okay, good. So just go ahead and relax for me, and then just there you go. I'm just gonna inspect your breathing, so go ahead and just breathe for me normally. Okay, and then what I'm going to have you do is when you feel my hands, if you could just say the words 99, okay?
Okay. 99, 99, 99.
Okay, good. All right, next thing I'm going to do is check for your anterior posterior diameter.
Okay.
So just go ahead and stand up, and I'm not feeling any barrel chest. I see that the ratio is 2 to 1 as well. Perfect. I'm gonna feel for tenderness in your kidneys, okay? So I'm putting my hand here and I'm just gonna hit, let me know if you feel tenderness.
No.
Okay.
Nope.
Good. We're gonna go ahead and percuss next.
Okay.
Actually, before I do that, I'm gonna go ahead and check one more symmetry for the lungs and the back. So I'm just putting my thumbs at the base of your lungs. Go ahead and breathe for me normal. Okay. See that my thumbs do expand equally. Now I'm going to go ahead and percuss, okay? So you can just
relax.
A little forward, yes.
Oh, yeah,
there.
go. Okay.
Just a little bit. There you go. We're going to do percussion. I'm going to go ahead and take a listen. So every time you feel my stethoscope on your back, you could just take a deep breath for me, okay?
Okay.
While I'm in the back, if you could just go ahead and put your arms up for me, please. Thank you. And we're just going to percuss the sides here, okay?
Okay.
Just like 3 areas we're doing on each side.
Do you want me to like?
Yes, that's fine. Thank you. And I'm just going to go ahead and take a listen to those areas as well. Take a deep breath for me. Great, so we're actually done with the back. So if you could just go ahead and face forward for me.
Yeah.
Same position.
Like this way?
Yes. So I'm going to listen to your lung sounds, and then after we'll just go ahead and listen to your heart sounds before we have to lay you down, okay?
Okay.
Good. Alrighty.
You want me to sit like relaxed again?
Yes, yes. Just trying to see if this works. Okay, so I'm just going to, again, if you could just take normal breathing for me. I'm going to take a look. Get set up more straight for me a little bit. Thank you. Deep breath, and I'm just going to look for your heart pulsation here while we're doing that. Okay. Alrighty, I'm just going to put my hands at the base here again. If you could take a deep breath. Good. Alright, so I'm just going to go ahead and percuss in the front again. If you could just hold that up just a little for me. No, it's okay. Good. Alright. I'm going to go ahead and take a listen here. Again, take a deep breath whenever you hear me. So I'm going to move on to your heart assessment now. We're actually done with the lungs. What I would have you do is if you could just lean back again one more time. I'm just going to check for the heart Oh, against the chair. Yes, I'm sorry. I just wanted to check for your heart. Your neck veins. Okay, for any bulging. If you could look to that side for me. And head back a little.
Oh.
No, it's okay. Okay, great. And then we'll do the same with this side. Okay. Great. So I'll have you face forward again one more time. Thank you.
Yeah.
And now I'm just going to go ahead and take a listen to your heart sounds. But what I would have you do is like kind of bend your shoulders forward for me so we can listen to that heart better. If you can go ahead and just pull that up for me just a little. Thank you.
Sorry.
No, it's okay. Then we'll go ahead and... Okay. Before I go ahead, I just wanted to touch here, feel right here. Feeling for your pulse. Seconds. Okay, pulse is 84. Okay, and then I'm just gonna put my hand up here, here, and in the same position again. Just gonna take a listen with the other side of my stethoscope. Okay, pull that up one more time for me. Okay, great, thank you. So next thing I'm going to do is I'll have you lay down. So we'll do the rest of your cardiac examination and your abdomen.
Okay.
And your stomach.
So just lay down over here like
Yes, please. So head that way and then feet point towards this way. Thank you.
Okay.
Okay. The next position, I would have you just lie on your left side for me. And then I would have
like sleeping position?
Like that, and then I would have you bend this leg a little, and then put your shoulder a little forward, just like basically we're dropping the heart corner, if that makes sense.
Yeah.
Yes. Okay. I'm gonna just sit right here next to you. Sorry.
No, you're okay.
Go ahead and touch here. Sorry.
No.
Okay, good. So you can lie back on your back for me. Thank you. Just gonna go ahead and do your abdominal examination, your stomach exam.
Okay.
Listen to it, and then I'm also gonna measure your lung.
Is this good?
Yes.
Okay.
Just normally gonna take a look here. Okay, good. Okay, I'm gonna go ahead and take a listen.
Okay. piece down.
Yes, thank you. Take a listen to your liver and your spleen. Then your arteries, aortic, your renal arteries here, iliac arteries, your femoral. You may just have to go a little down, I'm sorry.
It's okay.
Okay, good. Your bowel sounds are normal. I'm just gonna go ahead and feel for the pulsation here too with the femoral arch, so we can just like get that out of the way for now. So we already listened to it. Okay. Good. Next thing I'm gonna do is percussion. So same thing basically we did on your back and your chest. And let me know if you feel any pain. Okay, next thing I'm going to measure your lungs. If you could just hold this up for me a little. Thank you. I go from this mid. There we go. Okay. Go ahead and measure. About 8 inches. That's normal. Okay. Then I'm just going to go ahead and palpate.
Okay.
So, kind of some light palpation. Any pain?
No.
Okay.
Nothing.
All right. Go ahead and bend your knees for me, please. And then I do want to feel for any bulging here of the aortic. No. Okay, good. So I'm going to go deep palpate.
Okay.
We're just feeling for any masses or anything. Good. And I'm just going to go ahead and feel for your liver here, okay? Okay, take a deep breath for me. There you go. Okay.
Felt fine.
Spleen. And your kidney here. And come on that side. Okay. Go ahead and relax for me.
Like put my legs down?
Yes, I'm gonna feel actually for your pulses, okay?
Okay.
So we're just gonna do your radial, ulnar, brachial pulses. We already felt for your femoral pulses here. And then if you could, is it okay if I pull your pants up for you?
Oh yeah, I could do it for you.
Thank you. Just 2 behind your knees here.
Is this good?
Yes.
Okay.
And then right behind the ankles, we have your 2, and then right on like your feet here. Okay, great. So while you're lying down there, I do want to feel for your joints and your muscles.
Okay.
So I'm just gonna go ahead and take a look here. And you do have nail polish on. I do want to check for your basically blood flow, how fast. So I'll just check with the pads of your fingers, okay?
Okay.
And I see they are filling in within less than 2 seconds or so, okay? Good. And then one thing, can you put your nails like this for me?
Like how?
Like this. So your 2
like
middle
this?
fingers together, just checking for any clubbing. Okay, good. And then I'll just take a look at your hands, and everything looks normal. Good, and I'm just gonna feel down here, okay?
Yeah.
Your hips, your knees, any pain?
No.
Nope, doing the same here with the cap refill, okay? No pain. Looks normal. And no pain, right?
No.
Okay, good. So now we're just gonna check for range of motion of your hips, okay? So what I'm gonna have you do is bend your knees towards your chest for me.
Like pull them up?
Yes, pull them up and then back out. So I would have you just kind of cross this over, like swing it over, kind of like a half
this?
circle, yeah.
Like that?
Yes, back down. Same with this one. Ow. There you go. So now I'm gonna have you put this, I'm sorry,
This.
I forgot the name.
Oh, my leg, my heel.
Heel to your knee. I'm sorry about that.
That's okay.
So we can do an outwards motion.
Oh, go out like this?
And then go back in. Good. And then same with the opposite foot, please.
Okay.
My mind went blank for a second.
That's okay. It happens to all of them.
Okay.
Ow.
And then what I'm going to have you do is actually bring that heel and slide it all the way down to your shin.
Like
Good.
this? Oh,
Good.
do the same thing on the other side?
Yep.
Like
Perfect. Yes. Okay, good. So now I'm just actually going to check for some strength. So
Okay.
pull me towards you.
that? Okay.
Okay. And then push against me, push down, and then push backwards. Okay, gonna do the same with your feet. Do you
Okay.
want to scoot up a little for me?
Yeah, just a little bit. So
Thank
I can
you.
have, like, a-
Okay, push up, push down. Okay, good, good. And then words. So I'm gonna take this here, and I'm just gonna check for pain receptions in your feet. Okay,
Okay.
while you're lying down there, and just let me know if you feel it.
Okay.
So we're just pushing until this bends a little. Okay,
Yeah, sure.
you feel that?
Yeah, yeah.
Yes. Okay, sorry, just making
It's
sure.
really ticklish.
Okay, good, good. Sorry, just checking.
No, it's okay.
Okay, you can go ahead and sit up for me.
Okay.
So I'm gonna have you actually sit in this chair, if that's okay with you.
Yeah.
And just because we have to work with what we have, yes, I am gonna put 2 pillows.
That's okay.
I just need you a little bit higher off of the floor. So
Just
go
sit
ahead,
down.
yes, sorry, it might be a little jump.
You're fine.
Okay. So,
Is this good?
yes.
It feels high.
Yes. So now what we're going to do is we're going to check for the range of motion in your shoulders and basically your wrists and your ankles, your feet, and all that. Okay?
Okay.
So go ahead and put your arms straight out for me, and then to your side, and then up. And then I need you to put them back like this, then kind of backwards. Okay? And then can you just like roll your shoulders for me a little bit? Good. No pain or tenderness with any of that.
nothing.
Okay?
Feels good.
Okay, good. So with your wrist, hands out again, down, up, straight, and then go outwards, inwards, and then back out straight, separate, put them together. Okay, good. So now what I need you to do is, I'm gonna check for strength.
Okay.
So I'm gonna pull your elbow, kind of resist, don't let me pull. Okay, good, you're strong. Okay. Don't let me, and then I'm gonna push inwards, out, Okay, good. So next thing we're gonna do is I'm gonna do the same thing with your feet again. So we're gonna check for a range of motion. So if you go down, up, side, inwards, and then separate your toes, and then back together. Okay, good. So next thing, I want you to close your eyes for me.
Okay.
And then I'm gonna do 2 tests while your eyes are closed.
Okay.
So I'm taking this, and what I'm gonna do is tell me if this is sharp or dull, and please point where it's at.
Okay. Dull. Sharp.
Okay.
Dull.
Okay.
I'm sorry, do that again. Sharp.
Sorry, I just don't want to like cut you or anything.
That's okay. Dull. Sharp.
Okay.
Sharp. Dull. That was over here and it was sharp.
Okay. So while your eyes are still closed, put your hands out for me, and then tell me if this is up or down.
Down. Up. Down. Up. Down.
Okay.
Down. Up. Down. Up. Down.
Okay. Same with your feet here.
Down. Up. Down. Up. Down. Up. Down. Up. Down.
eyes for me one more time. What I'm going to have you, actually you can look at me first. I want you to do your finger to your nose, out, finger to your nose. We're going to start slow and then you can go faster, okay? With your eyes closed.
So for my, okay, so.
Yes. Okay, good. Good. Perfect. So next thing I want you to do is put your finger to your nose and then hit my finger. Does that make sense?
Yeah.
Okay.
So like.
Yes. As fast as you can. I'm going to move my finger fast. Just checking for your coordination. Good, good, good. So now we're going to play patty cake a little bit, okay? So you're just going to go like this, start slower, and then go faster. I want to make sure both are equal. Good. Great. Okay, next thing I'm going to do is I want you to close your eyes for me one more time. And tell me if you feel vibration or no vibration and where you feel it, okay?
Okay.
I'm going to activate.
I feel it in my ankle on the inside.
Okay.
I feel it on this opposite side.
Okay.
I feel it right here. I feel it right here.
Okay, good. Next thing I'm checking is I'm checking for your reflexes. We're going to test a couple, okay?
Okay.
So starting off with here, I'm just going to have you relax on here, and then I'm just going to strike my finger. Okay. Good. And then if you just want to rest here, I'm going to go in here. Okay. Just going to feel for this tendon here. Okay, good. So now I just want you to actually rest your hand on me, like just completely drop it. There you go. Same with this side. Good. And then we're going to do your knees and then your ankles. So just go ahead and relax. And then actually hold your, there you go. No, take a little.
I felt that.
Sorry.
It's okay.
Okay. Let me just hit this one more time. Okay, good.
Is that it?
Yes. Okay, next thing we're gonna do here is I'm gonna have you stand up
Okay.
and I'm gonna have you walk for me there and then come back on your tippy toes.
Okay, so
So
walk
just
regular.
normal walk.
And then walk back on like heels?
Your heel, your tip
Like
toes.
tippy toes, I mean? Like I'm
Yes.
wearing heels?
And then stop there. I'm gonna have you go back one more time, your shin to your toe, but then when you come back, walk on your heel.
Okay, so like this, you mean?
That when you're going forward, yes.
Yeah. And then walk back with a heel?
Yes.
I hate this. This walk is funny.
Okay, that's good. Okay, so now what I'm gonna have you do is just completely relax, hands at your side, close your eyes, and I'm just gonna stand here for 5 seconds. Okay, you can go ahead and open. And then actually step forward so you don't hit your heel there.
Yeah.
And I'm gonna have you bend one of your knees up, close your eyes.
My balance is very bad.
It's okay. Okay, that's good. You can put that leg down, opposite leg.
This one's the worst one.
Okay, there you go.
Good.
That's good. Actually, I would like for you to not do any support, but it's okay if you can't, then it's completely fine. Do you feel dizzy at all when
No,
you're doing
not
that?
at all.
Okay, good. Alrighty, so I think that actually covers all of our examination for today. Is there any questions you have for me?
No.
No?
I don't
Okay.
have any questions. No.
All right, thank you so much for coming in. Well, it was
Thank
nice
you.
meeting you.
It was nice meeting you. Have a great one.
You too.